Thank you so much. It's wonderful to be here, especially alongside such inspiring organizations that are doing great work. I'm Ashley Emerson, the Program Director at Health and Harmony.
And I'm Nora Tienekens, the Program Manager at Health and Harmony.
And our mission is to reverse tropical rainforest deforestation for planetary health. Our vision is simple. It's really for healthy people, healthy forests, and a healthy planet. And today we'll provide a case study overview of our planetary health approach to climate change and health in Madagascar. Next slide, please. At Health and Harmony, we position Indigenous and traditional and rainforest communities as the climate and conservation experts. We used a grounded anti-colonial methodology called radical listening, and we really do this to uncover and solve root causes of rainforest degradation. Communities design intersectional solutions to protect the rainforests, and these arise from this process, and we then partner with these communities to support the solutions with the highest quality interventions, partners, and resources. Next slide, please. Common solutions tend to focus on healthcare, livelihoods, and education. And in turn, communities protect and preserve the rainforest, its biodiversity, and so much more. So conservation approaches are oftentimes based on punitive measures, and this approach does not have very good outcomes. And moreover, human health is oftentimes dissected from the natural ecosystems that underpin it. But by working alongside local communities and restoring connections between human and nature, this approach offers a real win-win solution. At our proof of concept in Indonesia and Borneo, we validated the solution with a robust evaluation that showed multiple significant benefits. And that looked like in Borneo, around Gunung Palung National Park, about $5.2 million that was invested in community design solutions over a period of 10 years, which returned over 12 times, so 65 million in above ground averted carbon alone. It also stabilized the forest, 21,000 hectares of secondary forest regrew. And we saw a 90% drop in households that had been logging illegally, and then habitat protected for over 3,000 critically endangered Bornean orangutans. And the solutions also delivered numerous human health benefits, including a 67% decrease in infant mortality. And so this approach really demonstrates an actionable framework for achieving multiple sustainable development goals simultaneously. We recently received the UN Global Climate Action Women for Results Award for this work, which we're so honored to receive. And in the past 3 years, this model has been replicated successfully in Madagascar, which Nora will talk about, Brazil, and again in Indonesia, now protecting over 8.8 million hectares of high conservation value rainforests and working alongside over 135,000 indigenous, traditional, and rainforest communities. So we really believe this holistic approach represents a paradigm shift for climate change and health. Its critical insight for improving human and environmental health has been very straightforward: listening to communities and investing precisely in their interventions directly designed by them. Additionally, we ensure that each solution links human and environmental health. For example, patients can pay for healthcare with non-cash means, such as seedlings, which are then used in reforestation. Alongside communities, we co-design incentive systems that benefit people and the forest. So for example, communities can receive discounts on healthcare that's tied to their decreases in logging, extraction, or slash and burn agriculture. So this reinforces the co-benefits for human and environmental health.
Thank you. After we did the radical listening with the communities, which we very much see as the experts in the protection of the Manombo forest, we quickly rolled out program implementation in the areas of healthcare, training and regenerative livelihoods, and rice cultivation, food security, and education. Those were the main requests that were coming from the communities. And we rolled out this full range of programs in all these areas. We did this in a challenging year. This was last year during the COVID pandemic that picked up in Madagascar and globally. And we have seen so far, we have trained 925 community members in agriculture. 60% of those were women. And we have now another 1,000 community members that are enrolling in our second additional training that the communities requested. We built 9 seedling nurseries containing a capacity for 45,000 seedlings. And with those seedlings, we're gonna reforest inside the Manombo Special Reserve, 10 hectares and then 78 hectares around the borders of the park with the communities. And then we also provide mobile clinics. One of the big requests from communities was access to high quality, affordable healthcare. And so far we have seen 2,677 patients, on average 400 to 500 patients a month. And this is steadily increasing as the word gets out from our program. And these are communities in 31 villages surrounding the park, and they have all signed an agreement with us to protect the forest in return for these services. Next slide, please. So we learned that it's very important to roll out these interventions, especially in anticipation of lean season, COVID-19, and responding ahead of time to the loss of income and food for those communities. And as we were discussing in the breakout groups too, that COVID-19 is very much a symptom of a sick planet. And so this really calls for a system-oriented planetary health approach. It is challenging for us to find funding that is addressing intersectional areas, so that supports multiple sustainable development goals simultaneously. We often find that funding opportunities are quite siloed, either in health or conservation, and we're looking for funding that addresses both those issues. So we only have 10 years to significantly address the climate and nature crisis. So we believe that it's very important for us to scale quickly. We have now replicated in 4 rainforest sites in 3 countries, Indonesia, Brazil, and Madagascar. And we're using the data that we're collecting from the sites to inform and scale through other partnerships, create a virtual platform, and do advocacy. Next slide, please. So the next steps for us as an organization, we want to influence government development and climate initiatives to listen and invest in community design solutions. We have seen from our sites, our experience, that communities, traditional indigenous communities in the rainforest are already experts to how to protect these precious rainforests that the whole world depends on. And we want to do more advocacy and partnership building to get those investments going. We have to find and secure intersectional funding that supports both human and environmental well-being. And we continue to work with these communities in all of our sites across our 4 program sites, and want to scale Pantropical. So I just want to highlight that this is a perfect model in the times of COVID, especially a consequence of a spillover of animal and human interactions. And this is a unique place and opportunity to address both human and environmental health.
Thank you so much.